Hi everyone, good evening and welcome to Atp Live Monday. How are you doing? I hope you've had a lovely day. Welcome, whichever platform you're watching us on. Thank you so much for joining me today. First and foremost, I just want us to share the video and invite everyone to be here. I'm going to do the same. Welcome to ATP Live Monday. I'm Gbemisola Boyede. ATP Live Monday is a program where you get to ask any question. Oh, Major Evans, good evening. welcome. I know it's been a while. I saw you on Instagram. Thank you for your consistency. Thank you so much. And happy Father's Day to you. Happy Father's Day to all the fathers. Yes, we tried to celebrate you yesterday. I hope you all had a lovely time with the family. Okay, so happy Father's Day. We love our fathers. Even though I know that fathers don't talk much like mothers do, but fathers are very important as well for our children. So happy Father's Day to all the fathers. All right. I hope my system is not hanging again today. All right. Let me just close as many things I can close. Okay. I think I'll just focus on my Instagram. Don't know what's happening to my. Okay. Okay. Let's refresh. Okay. All right. Good evening. Good evening, everyone. I'm sorry. I guess my connection was kind of broken. All right, but anyway, okay. I can see Major Evans is there. All right. Just let me know you can see me in the comment section. Apologies for the uh, okay, I think I should just use all right, good evening. Let's share the video. Okay, I think I'm back online now. Okay, I'm just going to share the video first. Good evening, good evening. Welcome to ATP Live Monday. I'm not quite sure what's going to happen today. I'll still kind of and let be sure the internet works. If not, I may have to. Okay, so it's a little bit more stable. Yeah, yeah. Okay. Good evening. I think things are loading a bit more. Okay, good evening, everyone. I hope you can see me on my phone. It's not the same as the laptop. I don't know what's happening with my internet on the laptop, so but it's really having some difficulties. So I'm just going to restart the whole system and see whether that will solve the issue. But while we're doing that, let me just continue on my phone. Ifama, good evening. Welcome to ATP Live Monday. How has our day been? And then happy Father's Day to all the fathers who we celebrated Father's Day yesterday. So happy Father's Day to you all. Just let me know if you can hear me, okay? And then if you can see me right, because I'm trying to use my phone this time around. Okay, so let's continue. I got a couple of questions. Deles Peterson. Say good evening, Doc. My 6 year old had a tooth removed, and we noticed that another tooth has already started growing behind it. Is this normal? Yeah, that is completely normal. So the tooth that came off is the milk tooth. Those are the primary teeth. So they are all going to come off and one after the other, and they will be replaced by the permanent teeth, and that is what you are addicted to, and that is completely fine. So you don't need to worry about that. So yeah, you don't need to do anything. The new tooth is going to replace the old one that came out. So that is normal. All right, how that is clear. All right. Somebody is on joining us from from YouTube. Good evening, Emmy Lee and Nibe 932. Good evening. Thank you so much for joining me. All right. Thank you so much, everyone, for joining. I know we have a little bit of a rough start today because my internet is just misbehaving, and sometimes that happens a lot. I don't know why. So I'm restarting my laptop. Hopefully, maybe that will solve the issue. Once that has happened, then I can switch again. But I want to just say welcome to ATP Live Monday. This is a program brought to you by Ask the Pediatricians Foundation. You get to ask any questions that you may have about the health of your children over the next 1 hour, and I'll try and answer them as much as I can. So whichever platform you're joining on Facebook, on Instagram, on YouTube, you're welcome. Feel free to just drop your questions under the video directly, and then I will try and answer them as soon as I see them. Okay. But if you have any questions after the live session is over, remember you can always post your questions on our Facebook group, Ask the Pediatricians Foundation. And we will also try and answer your questions there. Okay. So thank you so much for joining me. And once again, I apologize for all the hiccups that we're having today. Technology sometimes can be a pain. But let's see whether I'll be able to get better connection now. So if you still have any questions about the health of your children, feel free to ask your questions now, and we'll try and answer them. For those on Instagram, I'm not really seeing your questions, but hopefully I'll quickly join you later now. Once I connect to my laptop, then I'll be able to answer your questions. Thank you so much, everyone. Um, okay. So I'm still waiting for your questions. I can't see any questions now. So while waiting, I will just continue to provide some basic health information that has to do with the health of our children. But let me just try and see if I can log back on my laptop and whether that will be better. So then that way I can see I think unfortunately I may have lost my Instagram connection, so that will be the challenge. All right. Okay. Let me see. Visual effects. Okay, that is ongoing. Okay, good. All right. That's fine. Let's enter the studio. All right. Okay. Let's remove this one. Okay, good. I think I'm back on my laptop, and I think that looks better. All right, let me see whether I can see Instagram people's. It's going to be a bit challenging, but I'll try. Okay. Okay. So just let me know if you can see me well now. It is better. Let me come off of this one. No, nothing stream. Let me just come out of this. Okay, yeah, I've come out of this one. Okay, and then all right, so that's good. Okay, so once again, you're welcome. Let me now share the links. I think it's better now. I think maybe my system is just hanging and it said it's over. It said, all right, so also help me to share the video. I'm going to do the same. I'm just going to do it on my phone. And for Instagram people, I'll be checking up on you on the Instagram page. Yeah, let's see. Okay, good. I can see Instagram people now. Okay, so if you have a question on Instagram, feel free to also drop your question. I can see you now. All right, so let's just share the video because I think we've not shared the link. So many of the people on Facebook may not have known we've started. So we'll just go share the video. Feel free to drop your questions. So I'm waiting. Okay, so that's shared. If you are just joining us, welcome. You're welcome to Atp Live Monday. Okay, sorry, I need to share the video again. Put it on WhatsApp as well. Okay. And then let's just also pin to the groups so that people can see it there as well. Okay, let me share to our page. Now we answer the one, and then we answer the second one. Emiliana watching from YouTube, if you have your question, feel free to ask as well. And I hope, yeah. Okay, good. Um, so I'm just going to go in it on our groups. Okay. All right. Somebody else will put this here. Okay. All right. Okay. I think I'm done with all the sharing and all the pinning. Okay. Good. So if you're just joining us, welcome, welcome, welcome. If you're joining on Instagram, you're welcome as well. If you're watching on Facebook page, Instagram, or YouTube channel, you can just drop your question directly under the comments in the comment section. But if you're watching on any of the Facebook groups, remember to go to the video directly and put your questions under the video. Okay, I think I have a new question from Emily Anipe. Um, okay, so your question is, my daughter, 2 years, 6 months, threw a lot of tantrums. Okay, and easily follow a stranger and refuses me or dad to carry her, throws herself on the ground, bites and pinch places. This normal? Okay, yeah, some level of tantrums is normal for a 2-year-old. In fact, that's why they tend to use the word terrible tools, but I like to say terrific tools. So 2-year-olds, they are beginning to develop what we call autonomy. They suddenly realize that they are very independent. They can do a lot of things by themselves. So because of that, they tend to, assert their independence. So they are more assertive. So that skill is actually something children need. Children need to be assertive. They need to know they're autonomous. They know to know they can do a lot of things by themselves, but they can also be quite challenging for parents at that time. So sometimes you get a lot of no's. So tell them to do something, you hear no, 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 and then they want to do that. So it's something we tend to get a lot in the 2-year-olds. Unfortunately, I know parents will try to explain and try to reason with 2-year-olds. The truth is that you cannot reason with them because at that level, understanding is limited. They are learning to speak maybe 2 word phrases, 2 to 3 word sentences. So they really, all those your long talk and everything, they don't understand half of it. So there's no point trying to talk to them or trying to reason with them or trying to explain things to them. So for 2-year-olds, the way around it is distraction. So if your 2-year-old is having tantrums, you have to find something else to take their mind off that particular distraction and take them to something else. So that is what we normally do with 2-year-olds. You want to distract them from the tantrum. So usually give them something else that they like and they've forgotten it. Sometimes you have to physically remove them, especially if they are going to put themselves in danger. You have to remove them from that situation. There's really no point trying to have that conversation with them or explain things that they don't understand it. And it is just that phase of their life where they just suddenly feel that level of autonomy and they want to exert it a lot. So it's okay, but you just need to make sure they do it in a safe way. So it is normal for tantrums to become more in 2-year-olds. And then, as they get older, then they begin to understand what we call consequence. So that is when, usually from around the age of 3, because that is when they develop what we call object permanence, when they understand that something, when you take it away, it doesn't disappear. And that is when consequence and, action and consequence really works, not in 2-year-old. 2-year-old, you remove them, you give them something else, and sometimes you just wait for them to go out of the phase when they're having the tantrum. So that is what. But the only thing I have in your comment that worries me is the fact that she wants to follow a stranger. That is actually not normal. Usually, most children actually have what we call stranger awareness, and they even have they are very and they have what we call stranger anxiety from around 7 months to 2 years old. So we don't really expect a 2-year-old to just want to go with strangers. That is actually the only red flag I'm having in that post. Otherwise, the tantrum itself, all those throwing herself and arguing or not wanting to do what you want is normal. But following stranger, I really want to be sure of that because that sometimes could be a red flag for something else, like things like autism and all that. So just pay attention to that. But if the elder aspect of the child development is okay, the child is responding to their names, they're speaking, 2 to 3 word sentences, phrases, and sentences, they're following instructions, they are playing with their friends, they have age appropriate, interaction with other children and all that, then yeah, I will just keep an eye on it. Just make sure that the child does not follow a stranger, because that can be dangerous. But otherwise, we're not really worried too much about that at this age. That is perfectly normal, so nothing to worry about. It's very important for us as parents to be familiar with what we call normal developmental milestones in our children. And most of us are quite familiar with the big ones, especially the walking and then the talking. But those are not the only milestones. In fact, when we call about milestones, we divide them into maybe 5 to 6 domains, so like different aspects of milestones depending on how you are dividing them. So if you want to just use the big headings, so things like motor, but you can divide the motor again into gross motor, fine motor. So gross motor will be things like sitting, neck control, sitting, crawling, standing, walking, running, riding a bike. Those are what we call gross motor skills. That's to do with the legs, what they can do with their legs. Then you have what we call fine motor skills. Those are the things they can do with their hands. Okay, like the child being able to pick up something. Sometimes when they want to pick up things, they pick up with their all 5 fingers. Then later they do what we call pincer grabs. They can pick up tiny, round, maybe something very small and tiny. They can pick it up with their forefinger and the thumb. Then they can start holding a pen, they can scribble, they can build blocks, and they start to draw, they start to write. So all those ones are what we call with our fine motor skills. So it's important for us to, when we are talking about our child development, let's not just focus on the big, maybe the walking and the talking. There are other ones. So gross motor skills is the walking part, but the fine motor skills are what the children can do with their hands. And then we have the speech. Again, when it comes to the speech, most parents, we tend to focus on the what we call expressive speech, the child talking. So most people will come, pediatrician, my child is not talking. But there is also another, so speech again, language and speech, you can divide into two. We have what we call the receptive speech, the child's ability to understand what we say. And then we have the expressive speech, that is the child telling us, their own words. So most parents will tend to focus more on the expressive. But actually, before a child can talk, the child needs to understand first. So are they able to follow instruction? When you call their name as early as 7 months, they should be able to turn to their name. They should be able to look at you. And when you say go get your shoes, one step command, they can follow that. And after a while, they get to 2-step command, go get your shoes and your bag, or put your ball inside the cupboard, that is a 2-step command. They should be able to follow those instructions, and so on and so forth. And then you get to the speech. First of all, they start with single words, and then later they go on to 2-word phrases, and they go on to 3-word sentences, and then they begin to speak like adults, usually by the age of 4. So that is language and speech. But there are also other aspects of development. So we also talk about what we call personal social, in terms of the child's ability to interact with people. So it starts with something as simple as social smile from the age of 6 weeks. A baby should be able to see you, recognize the mother or an adult, and smile, and then you smile. So that is what we call social smile. It's not the one they smile in their sleep. This one is a smile of recognizing people. And then they begin to, interact, they want to play, and then, they begin to do things for themselves. They can finger feed. So sometimes we mix personal social and self-help skills. We tend to group them together. Then they begin to play. Initially, they play alone, and then later they begin to play side by side with other children. We call that parallel play. And then later they graduate to playing together with other children. We call that cooperative play. Then sometimes they play using the toy the way it is meant to be used. So if you give them maybe a ball, they will kick the ball, they will throw the ball. But later they have what we call symbolic play. So they will pretend a pencil or a spoon is a microphone, and you'll be using it to sing. That's what we call symbolic play. Then they begin to do imaginative play, role play. They begin to say, I'm daddy, you're mommy, we have a baby, their teddy is the baby, they're feeding the teddy, they're putting the teddy to sleep, they're doing all those kind of imaginative play. So those are all the things that pediatricians are looking for in children. But most time parents, we are only worried about the gross motor and the expressive speech, but there are other things. And there are even other ones like the vision, the child's ability to see, and then then we also have what we call the hearing. So those ones are static, but we always like to be sure that the child can see and the child can hear, because they are actually fundamental to most of the other development. So if a child cannot see, sometimes then they won't be able to interact because they can't even see other people. So from 6 weeks, the child should be able to fix. When we say fix, in other words, if you bring something colorful to the child's, uh, face, the child should look at it, or even like your face, even your face as a mother, the child should be able to look at your face. And then when you move the object back and forth, then the child can follow with their eye. That's what we call following with their eyes. So the child should be able to fix and follow from as little as 6 weeks. And then, and of course, they begin to grab objects, then you know that they can definitely see. Hearing, usually from newborn baby, when you make sudden loud noises, the children should start to the noise. So that means they can hear, then they begin to babble, and then of course they begin to copy your words and all that. So those are all parts of developmental milestones. So I've gone into all that details just to say that if you pick up any sign in their child that they are, and we have an article on our website that talks about what is to be expected for each age group. So for each age group, there are certain things, an average time that some children achieve them. Though some children may be a little bit later in achieving some of those milestones, but that can still be normal. But then we begin to have what we call the cutoff age. So at those cutoff age, if the child is not yet able to do those milestones, then that is when it becomes a problem. And that is when we expect you to come and see us as a pediatrician. So I don't, because obviously there are so many of them. So I'm just going to give us a few of those cutoff ages. For example, if your child is not walking by 18 months. So most children will walk at 1 year, but some children will just be a little bit slower, which is still okay. But if a child is not walking by 18 months, we want you to come and see the pediatrician. If the child is not talking by 2 years at all, no talk, no speech at all, not even baba, mama, you have to come and see the pediatrician. Though we may also want you to see the speech therapist. If your child is not responding to their name, they are not turning to sound, you have to come and see the pediatrician. Though we may also want you to see the hearing, our audiologist, that is a hearing specialist, to have a proper hearing test first. So if the child is also not following with their eyes, they are not fixing and following, we may want you to see the eye doctor to test their vision, because everybody, no matter where to see, you still have to see the pediatrician so we can do a proper total evaluation of the child. So these are some of those cutoff ages that if your child is not able to do certain things, please, you should come and see us. When it comes to children, it is not just about the weight and growth. I know that most of you are very um, conscious of the fact that we like to measure the weight of the babies, and we do get a lot of questions about my baby's weight. Is my baby's weight okay? Is my baby's weight okay? That is good. That is one wing of what pediatricians monitor. We call that growth. We want to monitor the growth of the children. We want to check their weight. We want to be sure they are growing in size and in height. So we check weights, we check their height. But the second part, which is also equally important to us, is um, their development. So we also need to monitor their developmental milestones. So that is what I've been talking about now. So I hope that is clear. All right. So I just used the opportunity of the question that Emily asked to give a little bit of refresher to us on what normal development milestones in children. But it's so important. And if you if you're not sure whether your child development is okay or not, feel free to just reach out to your pediatrician, ask us a question, and we'll be able to help you figure it out. And the reason why it's so important is because for children, early development matters to them, and the brain is still developing in the first 5 years of life. 90% of the brain development occurs in that first 5 years of life. So if we pick up any problem and we begin to work on it, and we begin to deal with it, the brain is still plastic, so the brain can still adjust, the brain can still uh, improve. And so that is why we want to do early intervention, and that is why it's so important for us that we pick up our children on time if they are having any developmental difficulties, especially in the first 5 years of life. That is when we want to see them. Let's not assume, oh, the child will catch up later, things are going to improve later. No, the earlier, the better. So I hope that is uh, helpful. All right. So welcome everyone. If you are just joining us, feel free to ask your questions. I'm going to be here till 7 p.m. Nigerian time, West African time, and it's also UK time now. But if you are coming later on after the live session is over, or if you are watching the recording, yes, that is not a problem. Feel free to watch from the beginning to the end, because somehow you may actually have the answer to your question already answered in what we have said already. But if not, feel free to go to our Facebook group, and you can post your questions on our Facebook group from Mondays to Saturday, and we will be happy to answer your questions there as well. So not to worry at all. Just be patient with us. Sometimes it may take us up to 40 to 72 hours to respond to your questions, but trust me, we will definitely respond to them. Okay. And please feel free to follow us on all our social media platform, on our Facebook, on our YouTube, on our Instagram, Twitter. We are all over the place, so we are there for you. Feel free to follow us to learn. And most of these topics that we ask questions about, you can read them more, like all these things I've said about developmental milestone. If you want to read more, check our website www.axipediatricians.com, or you can also check our podcast channel, Ask Dr. Gbemi ATP podcast. You can also learn a lot from the podcast as well. And of course, our YouTube, all the videos are always on the YouTube. We don't delete them. So you can watch, and you can actually search for specific topics of interest that you want to learn more, so you can learn. You can search for those particular topics, watch the videos. There's really common ones that things like feeding. People ask a lot of questions about feeding, and we have article videos on complementary feeding, feeding your child in the first 1,000 years, 1,000 days, not 1,000 years, 1,000 days of life. 1,000 days of life is the first 2 years of life. If you count all the days of the child from birth to the first 2 years, is 1,000 days. So feel free to watch and read or listen, and you can learn. And of course, like I said, you can always post your questions on any of our platforms from Monday to Saturday, and we will try our best to answer them. Thank you so much. Apologies for the issues we had at the beginning. So I guess that affected a lot of people. May think maybe there's no ATP Live today because of the Instagram people. Thank you so much for joining us. I can see you there. So feel free to drop your questions. We still have about 15 more minutes before the end of today's program. But let me just also check that people are not dropping questions in the group. So if you're in the group, try and um, if you're in the group, it's best to drop your. You have to click on the video to drop your questions. Otherwise, we will not be able to see them. But let me just check that nobody has dropped the questions under the video. I don't think so. I can see any questions about the video right now. Welcome for those who are just joining us. Welcome to ATP Live Monday. Feel free to drop your questions in the comment section and we'll try and answer them in the remaining 15 minutes that we have. But if you are watching the recording or the after the live session is over, feel free to please go to our Facebook group, Ask the Pediatricians, and then you can drop your questions there. All right, that's what I just like to say. Let me check Instagram. Okay, I don't have any question on Instagram today. Wow. Instagram people, feel free to drop your questions, and if I missed your question, feel free to please ask it again because I know sometimes Instagram questions tend to scroll past quickly. Okay, seems like I have one question from Priscilla Nuhu. Okay, Priscilla, say good evening, doctor. Thank you for your help always. You're welcome. My baby is 5 months and I plan to do exclusive breastfeeding. Good choice, good decision, but it became difficult of change of job location. What is the problem with the job location and breastfeeding? I imagine that your baby is going with you for your job. Um, I want to know what to do, the do's and don'ts as a breastfeed and give milk as well. And when do I begin semi-solid? Thank you. Okay. Well, let me first of all commend you, Priscilla, for a decision to exclusively breastfeed your baby. That is actually the best choice. It's a good thing. Breast milk is best for your baby. And I'm happy you've done it for 5 months. I actually think you can do it for the remaining 1 month. I think you can. I'm not quite sure what the issue is with your job. I don't know. You say that I assume from what you are writing that you are going to take your baby with you to the same place. So in other words, you will go to work, but your baby will be at home and you're going to come back to the baby at home. If you are still listening, just let me know what is the current situation with you. But what I was going to say that going to work does not stop you from breastfeeding your baby. We recommend you can express your breast milk. So there are many ways around it. One, you can express, and the people that are with the baby can give the baby the express breast milk. We can give it either via a cup and spoon, which is our preferred choice. But some people always, oh, it's so hard to do it. It's so hard. Then if you have to do bottle, fine, but you have to make sure you are sterilizing, which is a lot more complex and more challenging. Whereas for cups, you just wash and dry them and they're fine. So we recommend expressing your breast milk and storing your breast milk, and then other people can help you feed your baby with the express breast milk. Your express breast milk, if you express in the morning, you can leave it for up to 6 hours, you know, without even keeping it in the fridge. It can be kept up to 6 hours on in the normal room temperature. But if you keep it in the fridge, it can last up to 5 days, you know. Just make sure when you express for enough feeds and you label it with the date and the time so that when they're feeding, they start with the one that was expressed first, you know, the oldest, and then they go down. That's the best way to do it. So that way they'll be clearing the backlog before going to the newest express. So you can express your breast milk, and your nannies or whoever is going to help you to take care of the baby while you're at work, they can feed the baby. Okay, and like I said, you can keep your breast milk in fridge for up to 5 days. You keep it in the freezer in your fridge, it can last up to 2 weeks. If you keep it in a dedicated freezer that you don't open all the time, it can last up to 3 months. I've actually known people that traveled abroad and they expressed enough breast milk down for the baby. They didn't travel with the baby, and the baby still had enough breast milk. I know, so it takes a lot of planning, but actually you lactate more than your baby needs. So you just may have to invest in something like electric breast pump, so that I find it's easier with electric breast pump. But you can also use your hand, but it may, the manual method may take a little bit of time. And for busy women, for example, if you're at work and you use electric breast pump, you can express your breast milk at work as well, and then you bring it home for your baby, store it, and your baby will have enough milk. Another option for mothers who don't like to express is you can take your baby to a crèche nearby your workplace, and then you just go and breastfeed your baby. Maybe most time when you breastfeed your baby, it's every 3 hours they need breast milk. So I don't know whether you're doing 8 hours or how many hours in your job, but at the end of the day, you may just need maybe 2 or 3 breaks to go and breastfeed, and your baby will be fine, and they will free the baby while you are at work. So it's doable if you want to do it. So that's just my advice. But if you don't, despite all this encouragement, if you still feel like it's impossible for you, you can still do formula. I mean, it's not as if the world is going to crash if you do miss feeding. No, but we always just want to encourage you to do the best first. But if you still struggle, fine, you can go ahead and do your formula and all that. But it's just that the risks with formula, you already know it. It's a lot more. The keeping the bottle clean and all that, and risk of infection is quite high. So it takes a lot more work to do that. So but it's doable. But from 6 months, you can start to give your baby semi-solid. So complementary feeding is from 6 months. That's why I say you're almost there. So and of course, when you start complementary feeds, you should still keep breastfeeding your baby, but this time around your baby can have the semi-solid while you're at work, and then when you come, so before you go to work, you breastfeed your baby very well, and then your baby can have the semi-solid while you're at work, and then when you come back, you still breastfeed more through the night, you breastfeed more. So we have a lot of resources on complementary feeding. So if you go to our Facebook group, Ask the Pediatricians Facebook group, we go to the guide section on complementary feeding. I really always want to recommend you watch all the complementary feeding videos first, because that way all the do's and the don'ts, like you were asking. Number one, you need to know the quantity to give, how to give, and the different food. Complementary feeding is not formula feeding. Let's just clearly state that. Even when you start complementary feeding, you still need to give your baby breast milk, okay? But if you still want to give formula, it's okay, but breast milk should still be ongoing. But semi-solid is you start, your cereals, your fruits, your different food, all the food in your kitchen. You can make it into a texture that is easy for your baby to swallow, and of course you give variety as well. So from 6 months you can start. Usually at that 6 months, you just need maybe 2 complementary feeds, and the rest should be breastfeeding. And then as they get to 9 months, you increase to like 3 times a day, and then you begin to change the consistency from porridge, like like liquid porridge, like thick porridge. Then you begin to change to mashed solid, and then begin to give them full solid by the time they're about 1 year old. So that is how to go about it. Okay, you say your current work will not allow you to baby to go with you. So does it mean that the baby is going to be at home and you will be in a distance? Because it's really challenging for a mom to leave a baby without, I really still would recommend that you find a way around. The best option is to have somebody like a nanny go with you and the baby, so they will be with the baby at home while you are at work. So unless you're saying you're commuting back and forth from home to the place and it's a far distance, it's always good for the baby to be at home with people who can care for the baby. But like I said, the best option for you would be to be expressing, but you have to express quite a lot. You may have to invest in something like electric breast pump, and so that you can express quite a lot and store and store and store and keep just expressing. Even when your baby is feeding one breast, you're expressing the other one, and you keep doing that and storing your breast milk. Remember to label them, remember to date them properly, so that will help. But don't feel bad, don't feel guilty if you can't. I mean, you've done 5 months, that's not so bad. But it just depends. The reason why I really feel for breastfeeding mothers is that's why we advocate for mothers to be on maternity leave for 6 months. honestly, you shouldn't be dealing with work when you're still breastfeeding. You should just focus on the breast. It's work on its own, and it's work that you're doing for all of us, all the whole country, the whole society, not just for your baby, because there are lots of benefits of breastfeeding, not only for the mother, not only for the baby, but for the whole family and for the whole nation. So when you breastfeed our babies, they are more intelligent, they live longer, and then you are also not stressed, okay? Because if you leave your baby at home and your baby is being careful for somebody, they're giving formula, those babies are at risk of infection, of illness, and then your mind is not at rest, your risk of making mistakes is higher. So that's why some of the states like Lagos states, even Ekiti, and some of them, they've proved that mothers should have 6 months maternity leave so that they have time to do their breastfeeding. We'll talk more in August about breastfeeding. Breastfeeding week is August, first week of August. So we always talk a lot more about breastfeeding, and we always advocate for the government to allow our mothers to be on maternity leave fully paid for 6 months, because that job they're doing, breastfeeding our babies, they are doing it for all of us. They are doing it for the whole country. Our babies will live, our baby will not die, and our babies will be healthy, very intelligent. So there are lots of benefits of exclusive breastfeeding, not just for the baby, the mother, but for the entire nation as well. And it's very cost effective. It doesn't cost them anything. All this our environmental population with the cans and the tins of formula is not there anymore. So it's something we want government to invest into and allow our mothers to have 6 months maternity leave so that they will have enough time to do the exclusive breastfeeding. They won't have to be worried like you are worried now. The work you have to go to work and all that. So it's stressful. We understand it. It's really, really stressful. So, but I'm hoping that in my lifetime the government will it will be it's already happening in some states, but we look forward to it happening all over the country in Nigeria, like whether private, government, all our mothers will have the 6 months maternity leave with full pay, because the reason why many of us are going back is, of course, we have to support our family with our income, and things are not quite easy. But if we are getting our income, I mean, that is the best work. Mothers love to stay at home and just breastfeed their baby. So we hope we will get there very soon. So, but do what you can with for the next 1 month, and then you can start your complementary feeding from 6 months, and I think that should be fine. All right. Thank you, Priscilla. If you want to learn more, we have our breastfeeding guide also on our Facebook group. So there's a guide one on breastfeeding. There are lots of videos on how do you continue to breastfeed when you resume work. There's actually a video on that for you. That's the one you need to watch. How to keep doing exclusive breastfeeding when you resume work. We have a video on that. We have video on every issue imaginable as far as breastfeeding is concerned. So how to maintain your breastfeeding, how to increase your breast milk supply, how to express your breast milk, how to store your breast milk. Everything has been done, and it's done in all we have it in multiple languages, in English, in Yoruba, in Hausa, and other languages as well. And they are very short videos, 5 to 10 minutes max, so that you can easily watch them and you can learn. So I always recommend that mothers should watch the breastfeeding videos, about 6, 7 of them, and they should watch the complementary feeding videos as well, so that they can learn how to do proper feeding of our babies from birth to the first 2 years of life. So, and then once we get because most of the time the challenge we face is the knowledge. Once we watch those videos, we will bridge that knowledge gap, and then we'll be able to do the right thing. So I'm happy for your commitment. I'm sure you can do it. All right. Thank you so much. My time is up. Once again, thank you to those who were able to join me, and those who join and maybe they have to disappear when my internet was misbehaving, but no worries. I really appreciate you all. But like I said, if you have any questions, because I'm signing out right now, feel free to go to our Facebook group and you can post your questions there, and then we'll also try and answer them as soon as we can. And remember that ATP is not just about being on social media. Beyond what we do online, we also do a lot of offline community outreaches. We just did our children's day outreaches in Kwara, in Akwa Ibom, in Abuja, in Lagos. So many children we touched, and we hope to do more. And so feel free to support us in any way you can. You can volunteer, you can donate, and you can support our team online and offline as well. So thank you so much. If you have any question or have any particular topic you would like me to address, again, feel free to send us either a DM on our social media platform or on our WhatsApp. Our WhatsApp is the best way to reach us, and I'm sure you can see it behind me right now. So feel free to reach us on our WhatsApp as well. And then, yeah, I think you can also email us on askthepediatricians@gmail.com, and we'll also answer you as well. So thank you so much, everyone. Thank you so much for those who joined me, especially Emilia from YouTube. I really always appreciate you being on YouTube. Thank you. And have a wonderful, wonderful evening. And I will see you same time next week. Hopefully my internet will not misbehave next week by God's grace. Have a wonderful evening, and it is. Bye bye.